wellness revolution starts now.
Today we are here to bust a myth that has been circulating around the internet. And as a pharmacist, I absolutely have to address this. This is something that has been top of mind for both prescribers and patients alike, and that is on the topic of ivermectin. So before you get too excited, if you've started to see some things circulating around the internet about reformulated ivermectin, that's why I'm here, is to address this and to settle this conversation. So as a compounding pharmacist with Physician's Preference Pharmacy, we've been compounding ivermectin for several years in oral capsule form. Let me just give you some background information on information circulating the internet right now, is that ivermectin is available in many different dosage forms and for many different species. So again, we compound human ivermectin. We know from the news over the past 5 years that ivermectin is available in a horse paste. It's also available as an injection, for example, for swine, which are pigs, or for cattle alike. So we're talking about many different types of ivermectin. 2 weeks ago, I started receiving some fearful messages from both patients and prescribers that were actually clips from Facebook. And I'm just going to read a couple of them here directly. It says, "Do not take ivermectin anymore. The formulation has been changed now to include Polysorbate 80 and titanium dioxide." Well, I wouldn't want those in my preparation either. It says these agents cross the blood-brain barrier and implant nanotech into your brain. Yeah, that sounds scary. So looking into this further, what I have found is, for one, we're talking about injectable ivermectin. We're also partially talking about the paste of ivermectin, which, let's remember, those are used for animals. So really, we're getting these questions because these are ingredients that we do not want in human preparations of medications. So let me kind of explain the confusion that's going on right now. In my opinion, we've got two camps. We've got the individuals who want to use ivermectin, which is a classic dewormer, and that's what it's used for in sheep and cattle and horses, and we also use it for that in humans. That's what it has its FDA approval for. And we have those people that have been using horse paste or squirting in the injectable liquid into their water and drinking it for anti-parasitic purposes. I highly recommend against that because, frankly, you wouldn't need dog food. So why would you be using a medication intended for something like a dog or a horse? We have the human ivermectin available. As a pharmacist, I will tell you this is a daily conversation that I have. It's usually as simple as either access to ivermectin, so somebody takes the horse paste or the injectable liquid because they cannot find a physician to write a prescription for them for ivermectin. And then secondly, it also has to do with those people that have been taking ivermectin in an oral capsule like this, for example, maybe getting our compounded version. They're reading this information on the internet. They're getting scared by it. Okay, so we're actually having a dosage form conversation. Let me repeat that. We're having a dosage form conversation. As a compounding pharmacist, what we specialize in is customizing dosage forms to the person. So if we're talking about a paste, an oral paste used for horses, or a liquid injectable used for large animals, that is a separate conversation than the oral capsules used for patients, and I will tell you why. Ivermectin is not soluble in water. So whenever we try to solubilize some sort of a powder in water, if it doesn't dissolve well, just like oil and water don't mix well, we have to do something to change the chemistry. And so, first of all, this is not new information. Just this morning, I pulled a copy of an article that was published on PubMed, published in 2023, Physical and Pharmacokinetic Characterization of Soluvec. So these are solubilizing agents that have been developed years ago to help ivermectin dissolve into a paste or a liquid. So again, separate than the powder that we receive at Physician's Preference Pharmacy to compound our ivermectin. So something else that I want to show you is that not all compounding pharmacies are created equally. And if you've listened to our information before, and largely what we stand on at Physician's Preference is quality. and also verification of our potency. And so what does that mean? What you get in your bottle, we test the potency of the products that we compound to be sure that what we're saying you're getting is what you're actually getting. Now, not all pharmacies may follow this practice, but we require that for ingredients that we receive, that we get a C of A, which is a certificate of analysis, along with those ingredients that we purchase. Then we also send samples out to verify potency. So we always trust and verify. And so should you. So if you have questions about this, you should call us and ask us about the source of the ivermectin and what's going in it, which is exactly what has been happening. So thank you for that. It allows us to explain to you what goes in our product and what is not in our product. Here I have an example from our supplier of ivermectin, an allergen checklist for manufacturers. So this is something that comes to us and asks several questions on here, such as, does it have peanuts or derivatives in it? What about milk and derivatives? Sesame, eggs, fish, wheat. We get a lot of questions if our preparations are gluten-free. Yes, they are. And then lastly on this list is, does it contain corn, titanium dioxide, and Polysorbate 80, which is bringing it back full circle to those original ingredients in question that are used to solubilize the ivermectin powder. And the answer across the board is no, no, no. It does not have any of those ingredients. So I can assure you that in your oral capsules of ivermectin, you are not getting Polysorbate 80. You are not getting titanium dioxide. So please, I hope that that has put some fear to rest. And if you have further questions, I encourage you to give us a call directly to speak with any pharmacist at Physician's Preference Pharmacy. And you can reach us at 281-828-9088. Please keep taking your ivermectin. At Physician's Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.